St. Flores Medical Clinic is one private health facility that was accused of trying to offer care to patients suspected to have had Ebola. The facility, located in Ingabano, Madudu sub-county, serves about 1,000 people every month. While speaking to the in-charge, Anatoli Musitwa, he said the care provided here meets the required standards as set by the Ministry of Health.
Actually, from the beginning it was as usual that we receive patients come, patients are treated and patients go. We discharge them when they are okay.
However, there came a time when many of their patients did not respond to treatment.
So what you do when you say a patient is not improving, you think for a higher level of care. So here we refer to Mubende Regional Referral Hospital. And all our patients, we refer them, they end up reaching Mubende Regional Referral Hospital. It was unfortunate that our patients we used to refer to Mubende Regional Referral Hospital, when they reach there, you could just hear bad news that people have died, which shocked us.
They didn't have the capacity. You can see even when they would bring those sick people to the referral hospital, they would get samples and send them to Kampala because the referral hospital did not have the capacity to detect the virus.
Musitwa says, following this unfortunate trend, an autopsy was conducted on one of the patients who died following referral, and it was then that they confirmed Ebola Sudan.
So when we had that, so the community, they started thinking that Ebola was just coming from St. Flores. Yet these people were coming while they are sick.
He says the announcement dented their work and, most importantly, their credibility.
It tortured us at the facility. We lost our patients. They couldn't come here because everyone was fearing to get a disease from St. Florence. Thereafter, people were almost killing one another, thinking that there are some rituals which has happened to make their family members die.
Musitwa also explained what caused the death of one of his health workers.
This staff of mine, Kenneth, he has been battling with ulcers for some good time. Actually, even when he used to be here, when he's very okay, he would tell us that the only disease which tortures him was ulcers.
With this said, why did the public resort to private facilities for care? Musitwa told us that the restrictions on movement left no other options at the time, and one had to travel more than 50 kilometers to access government facilities. However, Madudu Health Center 3 could only provide diagnosis and not treatment. The in-charge here, Kamu Kato, told us they had not received drug supplies for close to 7 months.
So they are now increasing in number actually, despite out of stocks for service delivery. And we are expecting our delivery very soon by National Medical Stores. Yes. Okay. The outbreak caused most of the patients or the sick people not to come to the facility. Actually, as an epicenter, most of the times you'd think Ebola is here, and that's what the patient thought. But we are thankful to the Lord because health education, sensitization, and mobilization, again by the implementing partners and Ministry of Health, enabled people to catch up and come for the services. Though in low numbers.
The resident district commissioner, Rosemary Biabasheja, told us she would seek intervention of her mother ministry to resolve the issue of drug stockouts.
So what I'm going to do, I'm now compiling my report of what transpired. And that is one of the recommendations. First of all, I'll report the matter so that the president's office can intervene. And these same reports, I think the DHO and COW also makes his own reports as a technical person. And if the COW's office reports, the DHO's office reports, the office of the president, which is the RDC's office reports, I think government will ensure that they handle this matter.
Walter Mwesigye, NTV.